Good afternoon, and thank you again for your service. My name is Crystal Reyes, and today I'm here to offer you some important information on what to expect from the healthcare system while living abroad in Australia. My goal is to provide you with the needed information to help you make your transition here as successful as possible. With the understanding that no system is perfect and that there is always room for change, there's no right or wrong way to do anything. My only goal today is to offer you an understanding of the healthcare system that you'll be experiencing while on deployment here in Australia. Let's start with some basics. Coming from the US, you may have to show proof of citizenship and be required to show an original birth certificate and other forms of ID in order to access insurance from your employer or the state Medicaid program. In addition to the mountains of paperwork, the wait can be long and the request for documentation tedious. If you are employed in the US, the same documents may be needed, and the wait time for new insurers is often declared by your employer and begins within 90 days of your hire date. Here in Australia, as a citizen, your coverage begins once you declare yourself a resident. You'll need to register and complete paperwork and visit a Medicare office 7 to 10 days after you arrive. Some things to consider. The US population in 2016 was 322.18 million compared to Australia's total of 24.12 million. As a citizen in Australia, you can expect an average salary of $27,039 per year, with a healthcare expenditure of 5.8%. Compared to the US citizen whose healthcare expenditure is 6.3%, with an average annual salary of $37,690. Although Americans make more money per household, per income, I think it's important to see that you have more Americans living in poverty and more in higher unemployment rate. The US uses a shared responsibility approach to healthcare, where the government, private health insurers, and individuals bear the burden of healthcare. Medicaid covers low income, the disabled, and children who would not otherwise have coverage. And those that are employed pay 1.45% of their income toward that fund. For those folks that don't qualify for Medicaid, private insurance is how medical bills are paid. Employers offer a carrier and pay a portion while the employee pays the rest of the cost of coverage, as well as any co-pays, deductibles, co-insurance, and of course, non-covered benefits. Australia takes a different approach. Australians utilize a hybrid system of care where residents, citizens, and refugees have access to publicly funded care that is provided by the government. Medicare is the mandatory public insurance that is provided. It is financed by tax dollars. Each person in Australia pays 1.5% of their income and can opt to purchase additional coverage. The additional coverage extends to specialty services and expands access to doctors and hospital care. If you choose to rely solely on Medicare for coverage, then you can expect to pay about 2.5% of your income. Although the cost of care in the US is almost double the cost of care in Australia, as you can see here, the outcomes are not indicative of the cost. In almost every area of physical well-being, Australians fare better and are in better overall health and better health than their US counterparts. One area of focus to mention is obesity. Although Australia is ranked second in overall healthcare system performance, 29% of the population is obese. Obesity is a major indicator of health and wellness in any community. Many Australians are overweight or obese and at higher risk of developing chronic conditions such as diabetes and heart disease. It's also understanding that people who live in lower socioeconomic areas are plagued with access to healthy food choices, better education, lack of better education, safe neighborhoods, and access to health care. In Australia, Aborigine and Torres Strait Islander people and people in rural and remote locations experience more healthcare disadvantages than other Australians. These disadvantages can include higher rates of illness and shorter life expectancy. The U.S. has similar inequalities, where studies have long indicated that persons who reside in lower socioeconomic areas tend to have earlier loss of life than those persons living in more affluent communities. In this slide, you can see U.S. men and women have about a 7 to 10, 12-year age gap in life expectancy depending upon their economic status and where you live, work, and play. I think it's important to point out that although the U.S. is one of the richest countries in the world and has held that title since 1871, in 2017 alone, there were 26,867 deaths of children under the age of 5, compared to the Australians' loss of 1,104 children that same year. Why this is alarming is that this is not due solely to drinking water, malaria, or war, but rather something even more insidious. According to a study published in January 2018, infants die more frequently in the U.S. than any other developed country. The lead author of the study noted that the U.S. is the most dangerous of wealthy democratic countries in the world for children. Across all ages and in both sexes, children have been dying more often in the U.S. than in similar countries since the 1980s. America's child mortality rates were related to infant deaths, automobile accidents, and firearm assaults. The study also indicated that a 15 and 19-year-old in the U.S. is 82 times more likely to die from gun violence in the U.S. than any other wealthy democratic nation. As of 2019, there were no federal laws banning semi-automatic assault weapons, military-style .50 caliber rifles, handguns, or large capacity magazines in the U.S. After one mass shooting in Australia, the National Agreement on Firearms all but prohibited automatic and semi-automatic assault rifles. They mandated licensing and registration, and have instituted a temporary gun buyback program that took more than 650,000 assault rifles out of public circulation. So from us here in Australia to you, we're happy that you're here. Thank you for listening.